Yes, I do face stigma and discrimination by the fact that I exist as a person, identifying as a transgender person in a very homophobic country that's homophobic and also transphobic at the same time. I do face stigma and discrimination at all levels, be it in communities, be it in society.
If you are constantly alienated from certain spaces, your mental health obviously is going to be greatly affected, and how you conduct your life in general, you as a social person. And I think that's why a lot of maybe queer people end up just maybe taking drugs, or just finding maybe other unhealthy habits that will make you like make you feel like, okay, I'm dealing with this, So I think it really affects a lot of, not just myself, it affects a lot of queer people and a lot of gay men in terms of the choices that they want to make. I think maybe some people even end up like just doing sex work and just being in risky behaviors.
The impact that discrimination and incidents of human rights violations, stigma, situations has on the community of people who use and inject drugs is that it exacerbates their vulnerability to HIV and other infectious diseases, even non-infectious diseases. For example, as a person, I want to go to the clinic and access health services. Maybe I have pores on my hands because I am an injecting drug user. Then the next person, the healthcare worker looks at me, stigmatize me, and maybe the next thing they want to report me to the law enforcement agents. So I would be afraid to access those services because I don't know what will happen, and at the end of the day, my health will deteriorate because of that.
The barriers that I face as a transgender person seeking services in Zimbabwe are looking at hormonal therapy, psychosocial support, mental health. Those are barriers that have been long existing, and people are starting to actually have conversations, but that inclusion is still not there. For me as a transgender person, when it comes to mental health, it is supposed to be a comprehensive package for me when seeking healthcare services. How do I deal with my hormones? How do I interact with the different myths and misconceptions that society have?
Well, the key resources and the knowledge we got from the capacity training, the LPP capacity training, was very helpful personally to me because it made me think of how important psychosocial support is and seeking psychosocial support services. It's something that we tend to ignore as people who do advocacy work or people who work with communities. We forget about our own self-care. And for me, that aspect of psychosocial support, that aspect of mental health pushed me to be in a space where I say, okay, enough is enough. I need to take care of myself mentally.
So the LPP program, Anitika, it also helped on capacity strengthening of my traditional healers, my pastors, vana ishe madzimambo vekumamisha vaya Nditika. You would find out kuti sometimes ukanzwa kuti wakakechwa nababa veapa musho yeapo waidaidzwa kwamambo kuti uya uripi mwekare kamhuku ubva utonzi ukungaiuye because iwe uri kuhura nababa ivo apo asi ivo baba ivo hawaripiswi. But through iyoyo LP Handitika, zvakabatsira kuti vanzwisise kuti aiwa sex worker atorowo kuitawo basa rake handiti. Saka hamufaniri kubva mamupa mutongo wakadaro because munhu atorowo pabasa rake, ende kuti munhu anzi ai sex worker panenge patorinochi murumewo anonga aripo. Ska the moment yamakufikisa mukadzi uyu makutomuita chi makutomudiscriminate.
So I think for me, like, to be honest, on a really personal level, for me it was just a matter of confidence. Because I feel like as a young activist and young people, we have so many workshops that deal with, that strengthen us in terms of maybe policy makings and, you know, stuff like that. But we don't really have, like, maybe I'd call it internship, you know, to see how those processes actually go. I've also had a chance to open plenary sessions, like for the village community during the ICASA conference. And just being able to stand there as a young person and knowing I'm representing my communities and being listened to, it really, you know, narrows the gap between maybe policymakers and the people that make the decisions, and us as the people that are actually going through these issues.
Linking policy to programming has changed a lot of conversations. You know, it has created spaces for young advocates and young people to actually have a voice to speak out. You know, the future is young, after all. So it has come with a lot of capacity strengthening. It has come with a lot of acknowledgement in terms of the loopholes within policies and how one can actually use a policy to actually achieve a goal.
The capacity strengthening activities that were held under the LPP project actually helped me, like in terms of registering our organization. And one thing that I am happy about is that our organization as youth was involved in the implementation processes of the drug master plan, a national master plan that runs from 2020 up to 2025. And I'm actually happy that because of the advocacy skills and leadership skills that I managed to acquire from the LPP project, I managed to speak on behalf of other young people who use and inject drugs on ministerial portfolios and meetings, whereby we're actually advocating for the implementation of the drug master plan. Now I'm happy that it has been implemented.
Parliament got involved in this project when we were invited, when a member of Parliament, which was me, was incorporated into the Key Population Forum. That was the first step. And it was important because though I'm a champion, I did not really need that engagement, but it got me to understand the community and the interaction and the challenges at a specific forum every quarter. But we then, as a parliament, as a full committee with champions, we did travel with the partners. There was a program that was organized by partners to sensitize members of parliament. It was actually called Meet the KP Populations. We traveled from here to Mtare to Maswingo, the whole of Zimbabwe. So it was, I think that step was the most important step. It made a lot of members of parliament who had never interacted with key populations accept that key populations are a reality. They are humans like us, they are among us, they live with us, and they'll always be there. And I could see, I felt after we had been there, we had gone round, when we came back, you could see there was a bit of change in attitudes towards key populations from parliament. And we even started pushing for the change in repealing of the willful transmission against HIV, the willful transmission of HIV. We managed to convince the Minister of Justice to use one of the bills that were on the table, which was the marriage bill, to repeal that. We actually did succeed, even in public hearings. But now, because it is attached to the marriage bill, and there's a contentious section 40 that was being challenged by chiefs, it has been delayed, but otherwise the president is ready to assent that the repealment of the willful transmission for HIV. It has had a big impact. The fact that the ministry could bow down and agree to train nurses to actually deal with the sexual anal sores, that was huge. And also, for me, the other impact, which I feel you can't hold it, but it's there. We argued that we should put condom in prisons because we believe men were having sex with men. So also relating it to the high HIV prevalence in the prisons, and that forced the National AIDS Council to actually start a study. We haven't received the results of the study. They wanted to confirm that those results would determine us to either put condoms or not. But most importantly, deep down in my heart, it will do something else. The Minister of Justice said, if the study finds that, then we have to remove the criminal law against Sodom, the criminalization of Sodom. Because you can't put condom, well, it means once you put condom, you have agreed that it's happening. And then you must deal with the issue of criminalization of Sodom. And that would also help a lot of other members of the community who are doing that.